Hi guys, I'm Gilberto Saenz with Dermcast TV. We're here in sunny Los Angeles at the SDPA fall meeting, and with me I have Miss Tina Moussally, Derm PA extraordinaire. Thank you for joining us. I really appreciate you taking some time out of your busy schedule today to pop in and just have a little chat with me.
Thank you for inviting.
Yeah. So I just sat in on your lecture, which was titled OTC medications. I'm sorry, OTC dermatology medications,
Yes.
which I thought was really interesting, and I think it's a super important topic because so many of our patients will visit us with already having used some form of an OTC medication prior to coming in, either recommended by a colleague, a friend, family member, maybe your primary care physician. Can you maybe give me a little bit of insight on your thoughts regarding OTC medications?
Well, there's a lot of self-treatment out there.
Yeah.
I think, long wait times to see dermatology providers definitely contribute to that. But they can be valuable to us as derm providers. We need to know what the patient has tried before, what hasn't worked, what has worked, can really sometimes guide us in some of the prescription products that we use.
What would you say, or how would you define a true OTC medication versus, say, like a cosmetic product of some sort?
So the FDA actually defines those as based on their intended use, right? So a drug, an OTC drug, is approved through a different pathway, right? And those drugs, based on the prevention, the cure, the mitigation, the treatment of disease states, right?
Mhm.
So if a product has an active ingredient, if you flip your product over, it has an active ingredient, then that active ingredient is either listed in the FDA's monographs or came through an NDA process.
Okay.
Yeah.
Um, do you feel that OTC medications are recommended by medical providers often, or do you feel like patients that have come in to see you with some experience with an OTC medication based on their own um, experience or recommendations from, like I mentioned earlier, colleagues or friends?
So both. I
Yeah.
think studies have actually shown that dermatology providers, more than any other medical specialist, actually recommend OTC drugs. And so there was some wild statistics that I read, like a study from 1998 to 2008, where it was 36 million,
Oh,
recommendations
wow.
by dermatology providers for skin products, for skin topicals. So I think they definitely adjuvant our therapies.
Yeah.
Yeah.
That's impressive. The 36 million.
Yes.
That's impressive.
Yeah.
Wow. Um, so, obviously we know that these medications are generally safe to use. Um, how would you say these over-the-counter medications kind of fit in your practice?
So I definitely will add them to regimens, particularly if I'm dealing with like an insurance situation where, the insurance may only cover one or two products, and I need to have the patient on multiples. There are many products that are over the counter that have higher strength prescription additives. Example, like a selenium sulfide
Mhm.
that's available in a 1%. 2% is prescription,
Right,
right? Or
right.
ketoconazole, same kind of thing. So we can definitely add those in. And sometimes patients aren't getting the results they're looking for, like for instance with acne.
Hmm.
So adding in something like a glycolic acid or a sulfur topical can help.
I know with my practice, sometimes, like you mentioned earlier, insurance can be a bit of an obstacle,
Hmm.
and I treat a lot of acne in my practice, and my demographic is a little bit younger, so I do treat a lot of teenage acne,
Hmm.
and sometimes insurance can keep us from prescribing what we feel we need for our patients.
Hmm.
And so I utilize some of these over-the-counter medications as kind of a stopgap in between until we can maybe kind of address some of the concerns insurance companies have before we can actually get the medication covered. And
100%.
and as a lot of these former prescription strength medications have become available as over-the-counter alternatives, it's been super helpful for me with my practice. Do you see anything like that
I
in
agree.
yours?
and if you've been practicing long enough, you've had the patient who comes in with like 30 topicals in a bag and puts them all on your counter.
Yeah.
That's always fun, But it can, like I said, it can direct us to know, for instance, if a patient has tried a benzoyl peroxide that is a low enough strength and has too much irritation with it, then we know, maybe not to prescribe something like that as well.
Right.
Yeah.
So kind of switching gears a little bit,
Sure.
cosmeceuticals are a huge part of any dermatology practice.
Absolutely.
How do you feel they have fit into your practice? Share a little bit about your thoughts on cosmeceuticals with me, if you don't mind.
Absolutely. So cosmeceuticals is not recognized by the Food, Drug, and Cosmetic Act. However, for us in dermatology as providers, what they mean to us is that the products have gone through some studies, and hopefully those studies were good studies that had randomization and controlled trials, and really falls on us as providers to do our research before we're recommending them. And you may not recommend just strictly one line. You may pick and choose from different lines, and I think that that's valuable. Um, Basically, though, they're not just a cosmetic to us because they do have some hardy studies behind them, and so I definitely think they have a place in dermatology. They are not products that you get from your local drugstore, and they have stronger percents oftentimes, and I think that they're valid, and I use them myself.
Yeah.
Yeah.
I think it's important for us as providers, but more importantly, the general population to kind of understand that these cosmeceutical products, you know, should only be recommended by someone with extensive background in that area, right? Like, for example, you don't go to, your, I don't know, I don't want to beautician, right? And have them make recommendations on skincare necessarily. They can maybe make recommendations, but honestly, I think with products that are stronger, like these cosmeceuticals that are only available through a physician's office, really the recommendation should be coming from someone with more medical knowledge and experience.
I agree 100%. I definitely think that it is valid to get your skincare regimens and your cosmeceuticals from somebody who knows skin.
Right, right.
In depth.
Yeah. A lot of these products, over-the-counter medications, cosmeceuticals, they have sometimes a long laundry list of different ingredients. And sometimes, we run into patients that have somewhat of a sensitivity to some of these ingredients. In your lecture, you mentioned some resources where we could go and find out, what some of the ingredients are within these over-the-counter products. Can you give me a little bit of information on that?
Well, there's two websites that I will share. One is that Walgreens, your local Walgreens, has on their website a list of all of the ingredients in the products that they carry. So I think that they have enough wide range products that you can probably find the individual ingredient list. I think that's very helpful. And then as well, while dermatologists sometimes question the scientific methods behind the environmental working group's recommendations, they do have a program called Skin Deep, and that Skin Deep program, which you can pull up on your internet resource. You can scan and it'll tell you the ingredient list of whatever you're using.
Oh, wow.
Yeah, so that becomes important if a patient is having, for instance, a contact dermatitis to some part of the ingredient. It doesn't mean that they can't use some of the ingredients in there. It just means that they may have something with that one particular ingredient. So you can sometimes figure it out that way.
That's super helpful, especially when patients come in, like you said, with their little baggie full of different products and not knowing exactly what's triggering any kind of reaction or sensitivity. Those are great resources for the patient and for us as well.
Absolutely.
Well, Tina, thank you so much for joining us. It's been a pleasure speaking with you. I really couldn't thank you enough for being here. I thoroughly enjoyed your lecture, and it was really nice to meet you.
Yeah, nice to have met you too.
Thank you so much.
Thanks.
With Dermcast TV, I'm Gilbert Saenz here in Los Angeles. Thank you so much.